demais. E além do mar Hey, Sarah.
Hello.
How are you?
Good. Lunch is made for tomorrow, and I got all the presentations.
My hair looks crazy.
So,
you look good. I look like a crazy person.
Oh, I literally I picked up Danny, and then I came home and got him settled, made lunch. I took a shower. And I did my nighttime skin routine. I'm ready for bed after this.
Wow. I'm showered and my hair just doesn't want to do anything. Yeah, I figure I'm going to turn myself. No one's going to see me.
No. Yeah. I mean, I'm going to, I figure I showered right now. I can tomorrow just kind of pull my hair to the side and, worry about Saturday later.
So I did talk to Dr. Leslie. She emailed me. She's like, you have my information wrong. She's like, I'm not a resident. I graduated already. I'm like, okay, I can change that. So
I know, because she reached out to Ginny, who reached out to me. So, and then Ginny reached out to me again, was like, oh, Dr. Leslie just got a hold of Kate. I'm like, okay. I was running upstairs to I'm like, okay, I got it. But
it was literally 15 minutes.
Yeah. I mean, and I was coming up anyway, because I got with the exception of one innovative idea person, the one who just got added, I have every presentation and poster for the entire conference now.
That's amazing. I did see your
It's the first time ever. I was just I got everything up. I had a couple replacement files to deal with. And I'm just this is never happened before.
It's a miracle. It's a conference
hey,
miracle.
10 years from now, when everybody apparently is retiring but me.
No, I figured 18 years. I have 18 years.
I'm there's no way that I'm maybe Gordy, but
yeah.
I'm not anybody else. So, but yeah, no, it'll be this, and then I have an alarm set to hop off for the satellite symposium, so don't forget.
Thank you. Yeah.
Mm-hmm. And we said we were going to close the help desk right at 7
Yes.
because like, okay, so then I can like log off and do whatever I need to do, eat probably.
Yeah, I know. I realize I have, well, the help desk, yeah, it goes to 7, but I have Gordy on it. I don't think it's going to see a lot of traffic.
I don't think so either. I mean, because I'll be in the hyperlipidemia until 7.
Yes.
So, and then after that, you know. How'd the kickoff go this morning?
Good.
Okay. I figured because there weren't any emails like, oh my God, you forgot.
No, it was fine. And nobody had any real, I mean, we went through some questions, but yeah, it was like 33 minutes and we were done. So
cool. Oh my gosh, I'm getting all my reminders right now for this meeting or this Zoom.
what do you think about taking the help desk off the schedule?
Which schedule?
Like the one in ePly, like I put it on there on the side so people can easily just click over.
Yeah, I think that's fine.
I know.
Are we live on YouTube right now? Am I seeing that?
Yeah, but I don't know,
top?
like on what, I think Torrance said it was just like a backup.
Oh,
So
okay.
I don't think we're actually live on anything.
I'm like, we're about to go viral.
So
yeah,
no
I think taking the help desk, I think that's fine.
Okay. I think so too.
Thank you, Torrance.
How do I get my picture off so Torrance doesn't have to look like an old lady?
I think he can do it. I've done it before because I come up as you all the time. If you go to like your settings or something.
I don't know.
Or like you right click. I'm trying to remember.
I'd like to hide all the people, like hide non-camera users or whatever anyway.
Oh, here comes Dr. Slayton. Yeah. Oh, for sure. Because otherwise, like, it's going to be like our pictures the whole time, and that's
right.
Weird. I mean, it looks better than I actually do right now because it was a Diana's son's wedding, but still, you don't need that for the whole recording.
Okay.
Mm-hmm. Did you put up an out of office?
I didn't.
Like a on-site type of thing?
Oh.
I might tomorrow, just because it's, if anybody's like, I need you to drop this, it's completely unrelated. I'll be like, yeah, no. Like I just got an email from Dr. Hickner about his podcast, and I'm like, oh, okay, that's not happening this week. So I might put one up. Just, you know, I'll be slow to get back to you. Blah blah blah.
I have to monitor the FMM email, so it doesn't matter. I'll be back and forth on my emails.
Oh yeah, I will too. I just want to be able to ignore people that aren't related to this, that are asking for something from like 2 weeks from now or whatever. Like, where's my certificate? It's like, it's on Tuesday. That's where it is.
Right. I really hope eApply works. I'm going to set up my other computer, one of the kids' computers tomorrow, but I just didn't think about it right now until late. So I can watch the thing.
Hey,
Hey,
team.
Dr. Slattengren.
I'm really trying
Hello.
to get my background to work. I can't get the family medicine Midwest background to work here. Let me see if I can make it happen.
Okay.
Oh, there we
It's
go.
optional.
Yeah, I know, but it would look better if we're all purple. Oh, Dr. Leslie.
Hello. Nope, she's connecting.
As we're like,
Yeah.
Yeah, exactly, talking.
Hi,
Hi,
Hello.
how are you?
doing well, thanks. How's everybody?
Good.
Good.
Good. Thanks for getting back to me with my last minute message.
Oh, yeah.
Today, Kate.
I know I saw it. I'm like, let me get to work. And then I heard your voicemail and I was just like, it's done.
Perfect. Thank you so much.
No, absolutely.
All right.
All right. So we're all here. Sarah and I are going to be, we'll kind of hide ourselves and put ourselves on mute, and so will Torrance. We're just kind of here in the background to be here for any tech support. What I'd like to do is I'd like to open this up in about 5 minutes, run our looping slideshow, Family Medicine Midwest slideshow, just kind of like as the background or as people come in. And then Dr. Slattengren, if you'd like to introduce her at 5. I know it'll probably only take a minute or two, and then it'll be over. I'll stop sharing my screen and then it'll be over to you. Do you want to practice sharing your screen or anything, or is
Yeah,
Zoom
maybe
is
I
over?
should now.
Okay.
And Slats, I didn't know you were going to be introducing me.
I
Good to
didn't
see
either.
you.
I didn't either. It's super fun.
I love it.
The last plenary I introduced was Dr. Critchlow back in like 2014.
Oh my gosh, no way.
Not big shoes to fill or anything.
No, not at
No
all.
pressure.
And not like I quote things she said to me regarding social media in my talk, because I do, obviously.
I'm so
Who
glad you're
wouldn't?
here. I'll let you practice sharing stuff, but did you have an awesome trip?
Yeah, I did. I really did. It was
Good.
great.
Good.
Best summer ever. Was great advice from Miller.
Oh, I'm a big fan of your TikTok, and my nieces actually think my job is cool today because of Daily Doctor Facts. So I'm like, oh yeah. So finally, once, they think I'm cool. So thank you for that.
Oh, I love it. Awesome. Good to meet you, Sarah. Okay, so let me just see here. I'll screen share. And do you want me to do this? We'll start not screen sharing.
Yeah, I'll start. I have a slideshow to kind of run for like the first couple minutes. So I'll be sharing my screen and then I'll stop and then you could share your screen. But if you want to practice right now.
All right.
And Dr. Slattengren, after you introduce her, you can turn your camera off and hide in the background also. But then for the question and answer, if you want to read the chat, any questions that come through the chat for her, and then you could put yourself back on camera. That would be okay.
Okay. Does it look good?
Looks great.
Okay. Stop making you guys dizzy with going through. Oh, one thing I wanted to try out was the videos.
Okay.
You guys just let me know. Is that playing?
It plays, but we can't hear it. So when you go to share screen,
Okay.
there is like an advanced button, I think, for sharing, like a thing at the bottom. I wish I could pull mine up, but to see it. There's like a thing at the bottom that I think is for audio. Torrance, if you're on, can you, or Sarah, am I explaining this? Am I correct in thinking that?
I think so.
Okay.
I can't.
It's okay if
It says,
okay.
yeah, so maybe stop sharing for a second and then go to share again. Here, let me try to share them and make sure. Yes. So when you open up share, all the way at the bottom, there's a little checkbox that says share sound and optimize for video clip. So you have to just click those two before you share.
So I go to advanced. Oh,
No,
oh,
it's
share
just at the
share
bottom.
computer sound and optimize screen share for the video clip.
Yeah.
Okay. Let's try that again if that's okay. Oh my, I have to install the Zoom audio device on my computer. If that doesn't work.
Hey, Dr. Cat, epidemiologist. I got a lot of people.
Yeah.
Okay, can you hear me too on my AirPods? Okay.
Yep.
Cool. Great. Okay. I can unshare now.
Okay. And of course my dog will bark. Okay.
I
I'll
know.
put myself on mute though.
So
There's gonna be somebody yelling outside or who knows what.
Yeah, no, exactly. But
Hi,
that's
so-
okay.
really
Everyone's used
quickly,
to
I
it
just
by
wanted
this
to say,
point.
my apologies. I just wanted to say, can you guys hear me?
Yes.
Yes. I just wanted to say that I heard the clip play through. Google Drive does have a little bit of an issue sometimes. So if you want to just really quickly, before we get fully started, while she's cycling the slides, download your presentation into PowerPoint just as a backup. There should be like an option that says download in Google Drive under File. It should say download as, and it should say PPTX or PowerPoint.
I will give it a try. I don't
Okay.
have.
Or yeah.
My computer is relatively new, and I'm sitting here being like, "Do I have PowerPoint on my new computer?"
Oh yeah. you
Okay.
might
It's
So then
not.
never mind.
it's opening
If you
in
don't-
Keynote.
Yeah.
Okay.
Okay. If you don't, then no, because Keynote is worse. So then we'll
Yeah,
just stick with
Keynote.
where we're at, and
That's not great.
I'll keep an eye on you. And if you want to shoot me a message in the chat, I'm Torrance Lewis underneath there. But I can also put AV chat if you
Torrance.
need. So
Thanks. And again, there's
No
two
problem.
video clips, and it's not, the audio is not extremely important. I could easily just kind of describe what is going on if people can't hear.
We also need to change your name.
Oh yeah, thank you.
Yeah.
Been a while. Thanks, Slats. I'm just gonna put my name because I don't really have a
There you
title right
go.
now.
Okay. Well, if we're all set, I'm gonna mute myself, stop my video, hide myself if I can, and then share my screen and do
Of course.
run
Not surprised.
this slideshow, and then I'll hand it over to, once I stop sharing the slideshow, then that's your cue, Dr. Sandgren, okay? All right.
Good evening and welcome. I'm Dr. Andrew Slattengren, one of the founding board members of Family Medicine Midwest Foundation and a proud family physician here in Minneapolis, Minnesota. I was really hoping to be welcoming you to our wonderful state in 2020 and then again this year, but I do look forward to hosting this event at the University of Minnesota in October 2022. So let's get started with Family Medicine Midwest 2021. Before I introduce our plenary, I would like to mention a few housekeeping items. All attendees are on mute. Questions can be asked using the chat feature in your Zoom toolbar. At the end of the presentation, I'll read questions for Dr. Leslie to answer. You'll find resources for this presentation and all of our education sessions under each course description. Because this conference offers CME credit, I must read and you must hear the accreditation and disclosure statement. So here we go. The Illinois Academy of Family Physicians is accredited by the Accreditation Council of Continuing Medical Education, ACGME, to provide continuing medical education for physicians. The Illinois Academy of Family Physicians designates this Internet Live Activity Family Medicine Midwest Conference 2021 for a maximum of 10.5 AMA PRA credit 1-2 credits. Application for CME credit has been filed with the American Academy of Family Physicians. Determination of credit is pending. The Illinois Academy of Family Physicians adheres to the conflict of interest policy in ACGME and the AMA. It is the policy of the Illinois AFP to ensure balance, independence, objectivity, and scientific rigor in all its educational activities. All individuals in a position to control the content of our programs are expected to disclose any relationships they may have had with commercial companies whose products or services may have mentioned so that participants may evaluate the objectivity of the presentations. In addition, any discussion of off-label, experimental, or investigational use of drugs or devices will be disclosed by the faculty. Only those participants who have no conflict of interest or who agree to an identified resolution process prior to their participation were involved in the CME activity. End scene. Now, it's my honor to introduce our opening plenary session and our presenter, Dr. Rosemarie Leslie. Dr. Leslie is a recent graduate and former chief resident at the University of Minnesota Medical School's North Memorial Family Medicine residency program. She'll soon start her next chapter at Allina Health with a focus on primary care and obstetrics. Beyond being an amazing family physician, she creates informative and engaging health education videos for teens on TikTok and other social media channels. Dr. Leslie is a star. Dr. Leslie is an authority. She has TikTok health education videos that have reached millions of views. This is a community service in the digital age and has been done well by Dr. Leslie. She was named most influential content creator on TikTok's 2020 top 100 list and named one of the top 20 social media influencers by Medscape. She's clever, she's creative, and she gets her credible family medicine message out there to counteract all the misinformation and downright bad info proliferating on social media. She has been invited to speak on social media and health education by Good Morning America, CNN, Rolling Stone, NPR, and the New York Times. She's a regular contributor to the ABC News Medical Unit and Care 11 News Morning Show here in Minneapolis. Please welcome my friend, Dr. Rosemarie Leslie.
Hi, thank you so much for having me, and thank you for that introduction, Dr. Slattengren. It is really an honor to be here. I was really excited that Family Med Midwest and all of you have asked me to come and speak today about this topic that I have learned so much about over the past couple of years. So I'm just gonna share my slides with you all here. Which of course takes a minute. All right. Okay, so today we're going to be talking about going viral, how social media can be used as a tool for patient care and advocacy. So I do want to give a disclosure. I don't have any disclosures related to pharmaceutical or healthcare companies at all, but I'm doing a talk on social media, and I have worked with TikTok in the past. For example, we have done a partnership to create a public service announcement during the beginning of the COVID pandemic to tell teenagers not to get together and make videos in the same household if they're people from different households. And so these are some of the things that I've been able to do with TikTok, but I do want to disclose that, especially since this is a talk about social media. So I want to start back to 2018 and give you all an example, one that you may already know about, but I want to talk about what happened when the Annals of Internal Medicine put out this paper called Reducing Firearm Injuries and Deaths in the United States, a position paper from the American College of Physicians. Now, after this paper came out, the NRA tweeted, "Someone should tell self-important anti-gun doctors to stay in their lane. Half of the articles on the Annals of Internal Medicine are pushing for gun control. Most upsetting, however, the medical community seems to have consulted no one but themselves." And they have this photo of a person, I think, who's supposed to be being a doctor. And I'm not going to get into the debate on gun legislation. That's not why we're here. Why we're here is to talk about how this interaction on social media sparked a movement within the healthcare community and created a huge discussion, elevating the information from the original paper to a place I don't think it would have without this discussion. And that was the "This is my lane" or "Stay in my lane" hashtag movement on Twitter. There was a huge response from healthcare professionals all over who had said things like, "Hey, NRA, have you ever had to look a mother in the eye and tell her, 'I'm sorry, we did everything we could, but your child died,' after they were shot? Because I have. Preventing gun violence is completely in my lane. No one should ever hear that." People were posting HIPAA compliant, but really, very, very serious, I guess, photos, right? Of what happens in a trauma, in the OR during a trauma, or in the ER, or physicians and what they look like after they have to deal with something like this. And so I think that this specific tweet, one tweet that was created by the NRA, sparked a massive conversation that politicians and the media were all aware of and became aware of. So social media provides healthcare professionals with tools to share information, to debate healthcare policy and practice issues, to promote health behaviors, to engage with the public, and to educate and interact with patients, caregivers, students, and colleagues. So I want to back up a little bit and talk about who uses social media. Why do we care? Is the general public using social media? Are physicians, are other healthcare professionals using social media? Why does this all matter, right? So the really good place for anybody who wants to look is the Pew Research Center. They have really the most up-to-date information about this and collect a lot of the data on social media use. So the data that I'm giving you is also from 2018. And so just know that I'm sure over the past couple of years, social media has become more popular, I imagine. And also there are new platforms that have become more popular. There's always a new platform. I probably don't even know what the new platform is. I need to talk to like some 15-year-olds to figure that out. But here's some data we have from 2018. So in 2018, 72% of US adults use at least one platform, and greater than 70% of teens use social media more than once a day. And here it kind of breaks it down in this graph by age group. And you can see that 18 to 29-year-olds are using social media a lot. 40% of US adults use social media for health information. This is anything from getting education to finding support groups to researching nearby providers or hospital systems. And that number goes up to 90% of adults ages 18 to 24. And I think as family physicians, this is a really important age group. This is the age group that we see, that we have continuity with, that we take care of from adolescence through adulthood. And so I think it's really, really relevant for family docs, especially. 88% of physicians and nurses use social media. So a really high number. And I wasn't able to find in the paper that I read, other healthcare professionals, but I know that there are a lot of pharmacists, epidemiologists, nutritionists who are also on social media as well. And then it's important to look at what policymakers are doing. So these are the numbers to kind of going through Facebook, Twitter, and YouTube, talking about and going over what percentage of federal policymakers are using each platform. And so if you look at Twitter, for example, in 2018, 100% of representatives and 100% of senators are using them. And I was pretty impressed with YouTube. I haven't personally seen a lot of policymakers on YouTube, but 80 and 94% do use YouTube. So this makes social media a unique venue where healthcare workers, policymakers, and the general public are interacting and spending a significant amount of time. And not only that, but they're talking about health. They're looking up health. They're researching health. They're sharing things about health. And so this is why it's so important, I think, that family docs are entering into this space and participating in these discussions on social media platforms, because we know policymakers are going to be there. We know the general public is going to be there. We have to be there too. We have to be participating in these discussions. So I want to talk for a second about what makes social media such a good tool for patient care and advocacy. And I will talk about risks and drawbacks later on in the presentation, but this is what just, I think, makes it so enticing. You can reach beyond geographic and institutional boundaries. You can, have a discussion with somebody or connect with a doc halfway across the globe, which has been really a wonderful opportunity that I've been able to have, is to find, like-minded docs who I can talk with about things across the country. You can recruit and form connections with allies and stakeholders. You can directly communicate with policymakers. This is a big deal. You don't have to write letters anymore, right? You can just @ somebody on Twitter. You can create targeted messaging on topics not covered by traditional media, something that the news won't pick up, right? Because it's not, a big enough story, or it's not something that they think has enough weight to merit a full article. This is something that if somebody has passion about, you can create messaging on a certain topic. Anybody can do it, and it can be really cost effective. It's a way to communicate with massive numbers of people, and you don't have to print off a bunch of flyers, for example, right? Social media can create change, and it can create change from an individual behaviors to systemic change. And I want to give some examples of different ways that social media can be used, specifically in the health context. And these are not all the examples I'm going to give, because there are way too many, but there are a lot. There are a lot of ways. This is just what I came up with off the top of my head. I'm sure you all can think of a million more ways that social media can be used, but it can be used from a variety of things like recruiting patients for trials and studies, community building, treatment adherence apps, promoting your practice if you work for a private practice, community engagement. I mean, there are so many different things that you can use social media for. And I want to focus on 4 because I don't have time. I could talk all day about all of those things, but I want to focus on 4 that I think are really important. So the first I want to talk about is policy and legislation. So policy and legislative advocacy, this was the trends and congressional considerations. They came out with, the congressional research came out with a paper about social media and adoption of social media by members of Congress. And so here they say, and I'm having to flip my bar down so I can read this whole thing, but social media have arguably enhanced the ability of members of Congress to fulfill their representational duties by providing greater opportunities for communications between members and constituents, supporting the fundamental democratic role of sharing information about public policy and government operations. And I want to talk more about Alex Smith and Nicole Smith Holt. Now, Alec Smith was a really bright, fun kid. He was 23. He came down with some flu-like symptoms, was losing weight, and his mom here, pictured, Nicole, she said, you really need to go into the doctor. He ended up actually being hospitalized and diagnosed with type 1 diabetes at that time, which was a pretty big surprise to the family, being diagnosed into your 20s. And luckily, he was insured under his mom's insurance policy. And so he was able to get hooked up with insulin and had a good regimen down that worked really well for him. And, he was, doing really well at work. And his mom, I had the opportunity to speak with her, said that he was doing really well at that time. And then when he turned 26, he lost insurance. And he looked at what his options were. And if he were to, his workplace, he was not able to qualify for insurance at his workplace. And if he were to go on the marketplace, he would pay a $450 a month copay, and he had a $7,000 deductible. That didn't seem like something that was doable for him or for many people, right? And so he ended up paying about $1,000 a month for insulin. About 1 month later, he was found passed away in his apartment, having died from DKA. And it was horrific. His mother described it as the most horrific thing that could ever happen to a parent. And she was furious, and she started advocating because this was the one thing she felt like she could do. She got a message from a friend on Facebook, actually, about how there were news stations that were looking for people to comment on how high insulin prices have been getting. And she decided to, pursue that opportunity and do an interview. And this led to her connecting with T1 International, which is an advocacy group for people with type 1 diabetes, as well as the Insulin for All movement. She was able to write an open letter to Eli Lilly Co., who makes Lispro and Humalog. That was a Mother's Day pledge. You can see that in the center there. That was shared wildly across Facebook. She created Facebook groups with Insulin for All. She partnered with celebrities. This was on Instagram with Jonathan Van Ness. To really spread the message about what the increasing prices of insulin and the insurance situation that we have currently did for her family. And in the past year, the state of Minnesota passed the Alex Smith Insulin Affordability Act. I want to get this right, so I'm going to read it. But it says that people can get a one-time 30-day supply of insulin each year for $35. That's it. Regardless, if you have diabetes, you can get your insulin if something happens for $35 for a month. And people who meet certain income criteria can get a 90-day supply for $50 every year. And when I talked to Nicole Smith Holt, she said, I believe that without social media, the story would have died. People would have forgotten, and we would have never been able to make the impact that we have. It truly amazes me to have people from all over the world find me and send their support, join our fight, and work with us to right this injustice. And all of this happened because I have the social media platform to show the world how our healthcare system failed my family. And I just think this is such an important example of how one person, a parent advocate, can use social media as a tool to create policy change in their own state to prevent another kid, another young man, I shouldn't say kid, he was 26, but to prevent another young person from passing away or to prevent one more person from getting sick. I think that this is just such an amazing and incredible example of how we can use these tools to help advocate and to help create policy change. The next example I want to talk about is health education, specifically addressing misinformation. And this is something that I will talk a little bit more about, kind of the work that I do with, but I want to talk about the COVID-19 pandemic and vaccine hesitancy. As I'm sure we are all working through right now, this exact topic about how do we address this? You know, when somebody comes into our clinic room and says, you know, oh, I've been reading this online, it's making me really worried, and then, you know, it's really, really hard. So we all know vaccine misinformation is really problematic and having a huge impact on COVID-19 hesitancy. And there even was a journal or an article in BMJ in 2020 that looked specifically at social media use and COVID-19 vaccine hesitancy. And they found that organization of groups and discourse within these groups, for example, like a anti-vax page or group, was significantly associated with increased public doubts about vaccine safety. They also specifically looked at foreign disinformation campaigns that were associated. They looked at 133 countries and World Health Organization data and saw a significant drop in mean vaccination rates over time. And this was not specifically COVID-19 related, because they were looking at, you know, more long-term information and data. But I thought that was really interesting. And here you can see off to the right, these are just some TikToks that I made a little screenshot of that I came across when using TikTok, that are just examples of what's out there. And there have been some really incredible responses by healthcare providers. Team Halo is a group of healthcare providers internationally who are, you know, organized together to help combat misinformation and increase, you know, vaccine awareness and vaccine rates. There's, you know, somebody from Portugal, and there's people from the UK and the US, and it's a really cool organization internationally. And then there is individuals, and there's a pretty big group of individual physicians who are using social media as a way to combat misinformation. And one of my friends, colleagues on social media, Dr. Austin Chang, and I got his permission before sharing this, but he this is just an example of information using a style that's engaging, that's interesting, and he's really good at dancing. And so here he is comparing Pfizer and Moderna in a very TikTok fashion.
We're gonna have a good day, and all my homies wanna ride today, and all these mommies look fly today, and all we wanna do is get back.
So that's him giving really important information, and some of these videos are getting, you know, tens of thousands of likes, hundreds of thousands of views. So it's really important work. Let's see how I get to my next one. And this is Dr. Kat, epidemiologist. She's amazing. Another person, I go follow her. She has been out there fighting the fight. She provides such amazing information to people, and she really gets into the science. There's a lot of people on social media who want to know the papers. They want someone to describe the papers to them, what's going on. And so here, this is what she put out when some of the Pfizer research data was coming out. And it's a minute long, so I'm not going to play it. I'll just give you a little introduction.
Hey, Dr. Kat, epidemiologist. I got a lot of people asking about the Pfizer vaccine results, so I want to talk about that with you. So back in August, Pfizer announced the results from the phase 1 portion of this study, which basically said it was producing an immune response in the participants and that it was well tolerated safety-wise. So now we're in the phase 2-3 efficacy portion of the study. So the interim analysis plan that they're using to look at the data along the way is they have pre-planned thresholds of amount of COVID cases that pop up in the study. So today they have 94.
So she goes in a lot more depth about it, but I mean, I think social media, different platforms give you so many different opportunities to share information in different ways. So she's using text here, she's using audio, she's using her face because you know her whenever her videos pop up, you're like, oh, Dr. Kat, you know? And then she's also including a primary source behind her. I mean, it's pretty incredible, right? Because this is an opportunity for her to say, hey, we need to be looking at the primary data. We need to be looking at the primary sources. I want you to look at trusted sources, and a way for people to practice doing that. So we talked about policy and legislation. We've talked about health education and combating misinformation through social media. I now want to talk about promoting health equity. And a great example of this is an organization called Health in Her Hue. And to give you some context, I want to talk a little bit about some research that is preliminary research in 2018 that came out from the Stanford Institute of Economic Policy and Research. And this suggests that having a Black physician could improve health outcomes for Black patients. So they looked at Black patients who had a racially concordant doctor and saw increased rates of cholesterol screening and diabetes screening and more. These are just a couple that I pulled. And models from that research predicted a 19% decrease in the disparity in cardiovascular mortality between Black and white patients if the screenings were to increase that amount. And so with that context, the two founders, Ashley Wisdom, who is an MPH, and Edwina Bright, who's an MBA, they created Health in Her Hue, which is a digital platform that connects Black women and women of color to culturally competent and sensitive healthcare providers and offers health information and content that centers Black women's lived experiences. We are reducing racial health disparities by leveraging the power of technology, media, and community to improve health outcomes for Black women and women of color. And I think this is such an important, they have an app, Instagram page, website, and I do actually talk with people, with friends, with patients about Health in Her Hue, because I think it provides such an important resource to help create connections and to help reduce health disparities. And then the final example I will give is about community building. And here we move over to Facebook. I think kind of where we started, talked about Facebook, TikTok, Instagram. Here we are back at Facebook with the Hematology Oncology Women's Physician Group. So this was started in 2015. And they actually did some research on this group, which I thought was really interesting. But they had goals of increasing female mentorship and leadership, representation, navigating work-life integration within the constraints of a gender-structured society, education, case discussions, and discussing experiences with gender bias. And 83% of its over 1,000 members use the site daily. And these are all, people who work in the HEMONC field who are women. The most common uses for this site included education, advice on complex cases, emotional support, and networking. And so this is just such a great example of a healthcare provider network that has really created such a great space for people to get so much benefit, right? From education, asking people advice, and just getting support. But also it's important to know that, there are so many communities that are built on social media within the patient sphere as well. So support groups, reaching out to people who have, kids who have similar illnesses, things like that. That's a huge tool that social media provides, both for people who work in healthcare and for people who are experiencing the healthcare system. So I now want to talk about how to get started. And I know Dr. Slattengren gave a great kind of introduction, and I'll just briefly cruise through this. So essentially, I got started in my PGY2 year, so a couple years ago. I just started, I found TikTok as an app. I thought it was really fun. It gave me Vine vibes, if anybody remembers Vine. And I just thought it was so silly and fun and engaging. And I saw that a large portion of the people who use it were teens. And I worked for many years in health education, specifically with adolescents and in sexual health. for many years. And so I said, hey, why don't I just start posting some relevant information on TikTok? And things just kind of blew up from there. I did, work quite hard and continue creating posts and making content over the past couple of years. And it's really been a wonderful way for me to use some of those health education skills outside of the clinic room. And I know Dr. Slattengren already talked about the opportunities that I've been able to have because of the work that I've been doing on social media. Here they are listed. And the opportunity to talk to all you folks today. But I want to give you a framework about how you can do this yourself. So I know a lot of people have talked with me and said, hey, I'm worried about starting, or what do I need to be thinking about before I do this? And so I want to talk to you about a few points, a few things to consider before you do get started, or if you're already on social media, how you can use social media to create a bigger impact. So one of the things to think through is, what is my goal? What's my goal with doing this? Am I using this as a way to, connect with my small town community as a new family doc in that space? Am I using this as a way to advocate for a specific policy that I'm really passionate about? What is my goal? What platform will help me best reach this goal? Different platforms have different kind of vibes to them. Different platforms have benefits, they have drawbacks. And so it's helpful to understand each platform before trying to figure out which one will help you best achieve your goal. It's also important, once you get on that platform, to understand which stakeholders you can recruit to help you, or that you can work with or get advice from. And then finally, am I posting this with intention? And I will go through a long slide about all the things I ask myself before I post, so that I make sure that I'm posting in a very respectful way. Okay, so these were just some of my goals, which there were many, but just to briefly kind of breeze through this, health education, that's something I'm really passionate about. I love doing that. It's part of the reason I became a family doc. That was really one of the main goals for me. I wanted to minimize the power differential between physicians and patients and show the general public, hey, here's a physician. We are, we can be silly, we can be goofy, we can have fun on social media and also share really important information. I wanted to bring awareness to social justice movements and how they relate to health. I wanted to help young people understand the scientific process and what it is to find a good and trusted source. And I wanted to address medical misinformation. So next, let's talk a little bit about platforms. Some of you may know this already. These are just some platforms that I wanted to share, some of the more popular platforms. I did not pick like LinkedIn or Doximity. These are more just kind of the general platforms that people can connect with the general public with. And I'll go through all of these. Just to let you know, these are just from my experience working with these platforms. Every single person has a different experience working with different platforms. And so you may feel free to add in or message me if you have any other thoughts about different platforms, their benefits and their drawbacks. So MedTwitter, we'll talk about Twitter first, because I think, and maybe I'm wrong, but it seems like the majority of health professionals who are on TikTok, or I'm sorry, who are on social media are on Twitter and have heard of at least MedTwitter. It's a great place. It's a great place to learn, to advocate for patients. There are policymakers that exist in that space, 100% of them actually federally. And so Twitter is a great place for us to share information, for us to have direct contact with our legislators. I have personally found it difficult to break out of the academic and medical and political spheres and reach the general public on Twitter. it's very rare that one of my tweets will reach a lot of people who are outside of that sphere. And so I tend to use Twitter more so for, sharing papers or connecting with colleagues, cross country, or adding certain legislators if there's something that I'm working on as far as advocacy and policy goes. We all know Esther Chu, so there's just a tweet of her doing that there. Facebook, I think the great benefit to Facebook is the ability to create and connect groups. Facebook has a great platform for creating groups where people can share information and creating events, which I really don't feel like other platforms have quite as robust of a space for both of those things. And so that's why I think you see a lot of support groups and things like that on Facebook. It is based on the numbers with Pew Research Center. It's less popular with younger people compared with other platforms, but it is still one of the most widely used platforms. And I do tend to see fewer dedicated professional medical accounts. And so I see fewer physicians who have a professional Facebook account. Next is Instagram. This is Mike Natter, who is a physician and illustrator who agreed to have me use one of his images in this slideshow. I think the great thing about Instagram is visual learning. And that is changing a little bit because of the new Reels function, which is a video function that's similar to TikTok that Instagram kind of put into their platform recently. But it gives such a great opportunity for visual learning. And I see a lot of content related to medical education. So people talking to, who post a way that they remember a certain, fact that they need to remember for one of the step tests, for example, and then they'll have a picture of that. It does tend to have a younger user base in general. There is some promotional content. I think I see that probably the most on Instagram. I don't have the numbers on that though, within the medical field. I do also see a lot of people advertising their practice and creating Instagram accounts for their medical practice on Instagram. YouTube, I think, can be a great tool for in-depth education. Just because the video lengths on YouTube are so much longer, you can really dive into a topic and discuss it in so much more detail. I don't see that much physician-run content on YouTube. I know that there are some kind of social media personalities on YouTube, like Mama Dr. Jones in the top right, and Dr. Mike. But in general, I don't quite see as many physicians having YouTube. It might be because it's pretty darn time intensive. I have been trying to start a YouTube and it takes me forever to edit videos. I don't know anything about video editing. So if you're good at video editing, this may be the platform for you. But it does take some time and requires you to at least learn how to do a bit of video editing. I do see a huge opportunity for YouTube though. YouTube is the most used platform. And so people watch it like TV. And so if we are able to create educational content on YouTube as family docs, I think that would be really impactful. TikTok can give mass education to mostly teens. The user base is expanding on TikTok. It started off having a quite young user base, and that has changed. The thing about TikTok, so you do also need to have video editing skills, but it's just not such long videos, so it takes less time. But the thing about TikTok is that any video has the potential to go viral with a huge group of people, which tend to be the general public. There does tend to be some mistrust around TikTok because it's a newer platform and it's owned outside of the US, which is a whole long thing that I'm not going to go completely into. But I know that that's something that's been expressed. People saying, hey, is this something I want to do? It's a newer platform. Should I stick to the tried and true ones? So going back to our framework, let's talk about recruiting stakeholders. So you can recruit stakeholders and increase the kind of momentum around your post by doing different things, like using hashtags. I know that I often will use hashtag FM Revolution, or using hashtag to make a point or support a bill. You can at important stakeholders to draw them into the conversation, like Dr. Renee Critchlow did up here, who was one of my former faculty, a wonderful physician. She taught me a lot about social media when I was just starting out. You can also at legislators, policymakers, nonprofits, other docs to really gain momentum around whatever it is that you're posting. And then this is my very busy slide about posting with intention. So people always ask me about, what do I do to make sure that my post is going to be okay? How do I know that it's not going to offend anybody? How do I prepare for my post? How do I make sure that this post is going to give the best information in the best way? And a lot of this I have just learned along the way. And it's important to know that if you're starting out, make sure that you are really taking a second look at what you're going to post, and also understand that you're going to make mistakes. Just try to make sure that you know which are the mistakes you really don't want to make, and try not to make those, like HIPAA violations, for example. But you're going to make little errors here and there, and that's okay. Make sure you just delete, apologize, and move on. But these are some of the questions that I ask myself when I'm creating posts. First, what is the purpose of this post? Is it evidence-based medical information? Is it creativity? Is it fun? Is it humor? Is it explaining what I do every day? Kind of like a day in the life. If you are going to be considering using humor, I would say, please approach with caution. Dr. Glaucomflecken, who most of you know, if you don't, look him up. He's an ophthalmologist. He is hilarious. He uses humor in a very great way, because he is never making fun of patients. He is never making fun of illnesses. He will often tease at physicians, at himself, at our colleagues, in a way that is not offensive. And I think that's really kind of the gist of what he talks about in his video, where he talks about how to do humor well. It should never be at the expense of a patient. And so that's something that I think is really, really important. Go look up he's on Twitter is where he started, and then he started making TikTok videos, but you can find him wherever. I just thought that was just such a good video to learn about humor. So then I asked myself after that, do I need to prepare for this post? So some, like a day in the life videos, you really don't have to prepare, right? You're like, hey, I'm waking up, I'm drinking my coffee. I have to go see, 18 patients or whatever. So this is what I do before I go to the clinic, that kind of thing you can be pretty spontaneous with. But it's important to know, like, if you are giving health information, especially if it's something that's being debated, that the general public is debating, please prepare. Make sure that you have your resources, make sure that you have the correct data. And if someone this has happened to me before, where if somebody in the comments section gives you other information, look at it, check that information, check the source, and it's okay to take stuff down. If you make an error, it happens, but please prepare if you're going to be providing information that is, data driven. Another thing to think about is, does the tone of this post match the content? And so if there is something with really, scary statistics about deaths related to COVID, for example, maybe pairing that with a humorous, kind of tone isn't the way to go. You want to be thinking about those things. Another thing is, am I speaking from my own expertise? is this within the scope of my practice? And am I posting evidence-based content? Always recommend evidence-based. I'm sure we all think that. I think one thing as a family doc that can be hard is there's so much that we know about. There's so much that we learn about that I think sometimes I'll think to myself, gosh, should I be referring to, reproductive endocrinology for this? And then I think to myself, hey, as a family doc, my expertise is in communicating complex medical information to my patients. And that is where, so we have so much skill as family docs. And so you share it, right? Share that information, make sure it's evidence-based, but please share information. And then, is this post a good reflection of me and my profession? Think about, again, could this in any way offend? Is this HIPAA compliant? Again, I've got this little bar that I'm flipping back and forth. Here we go. You guys know what I'm talking about, the Zoom bar. Okay. And then the last one, would I be okay with this post on the cover of New York Times? That's the best one. So if you're at all questioning, just think to yourself, would I be okay with this post being on the cover of New York Times? And that will usually give you the answer about whether or not you should post it. Okay, then I want you to understand the risks. Social media has so many benefits, but it also can be a bit of a tricky place. The example that I give is a online friend of mine, Dr. Nicole Baldwin, who's a pediatrician. She posted a video about a year and a half ago, just very simple recommendations about vaccines. Totally in line with what the CDC says. It was a simple, great educational post from my perspective. And it got picked up by an anti-vax group that was very severe. And she ended up getting threats. And it was really quite scary. It also got picked up by the news. And that is a really severe example of what can happen. But these things can happen when using social media. And so I want people to know that. And just be aware. Be aware. Another thing is that disagreements happen. People want to debate on social media. It's a very fun place for people to debate. Sometimes people debate way more on social media than they ever would in real life. But I always say, is this the best place to be having a disagreement and an argument or a debate, right? And again, Dr. Critchlow, who I mentioned earlier, she always said to me, don't feed the trolls. And I can't say that enough. Just if there's a comment that seems disrespectful, inappropriate, somebody trying to spark up a heated debate, you can block, you can delete, you can ignore. Those things are going to really help you when you are creating social media content, because regardless, it will happen. People will want to debate. And again, sometimes debate can be good and it can be done in a good way. And sometimes it can be not so good. I talked about don't feed the trolls. Anything you put out there will be scrutinized by many. So know that. That's why I use all of those questions that I just went over to make sure that if I'm posting something, I am posting something that's respectful, that's evidence-based, that I know that I will feel okay with. I talked about you'll make mistakes, apologize, take down the post if you need to, and move on. And another thing too is social media and mental health. I think it's really important to talk about that. Social media platforms are designed for you to get sucked in, for you to want to do it more and more. And all of these kind of things I talk about in this risk section can impact you. And so if you need to take a break, do it. Just say, I'm not going to do this for a couple of months or a couple of weeks, a couple of days, whatever you need, but pause and take a break if you need to. And then I think one final thing that I want to make sure I'm talking about before we do questions, okay, I'm good on time, is if you're wondering where to start, if you're feeling like, gosh, there are so many people who are on social media, the public, policymakers, I have an important voice and I should be using that voice, right? In this space where so many people are talking about healthcare. If you have those thoughts going through your head, but you don't know where to start or how to do so, you can join a professional organization. There's now a professional organization, the Association for Healthcare Social Media, that has a lot of tools for people. And I think it's just a nice way to be able to connect with others who are trying to use social media and learn best practices from a professional organization. All right, well, that is the end of my presentation, but I am totally open to fielding questions, talking about different things. If you would like to get in contact with me, please do so. You can find me on any of these places, and I answer both on my email and direct messages on my social media platforms. Twitter is probably the best one because I'll see it the fastest, but please feel free to ask me any questions, and I'll take some questions now.
Thank you, Dr. Leslie. That was so informative and timely for what we're seeing right now in the media. So look, you just completed your residency and you're starting in the very near future. What role will social media have in your career as a family physician?
I think social media can have such a huge, plays such a huge role in people's careers. For mine personally, it's an opportunity right now. I'm moving to a more rural area, and I want to be able to connect with my community. I want to be able to do public health work within the 20-person town that I'm moving to. And this is a way for me to get in touch with people, to put out public health messaging, to potentially work with the city and really communicate, community build in a more rural space. And that's something I'm really, really excited about. It's not something that I've done before, and I'm really excited about doing as a family doc. Again, the health education piece is huge. I mean, we always think about social media and we think about people who are young adults or late teens, and this is really the ideal, I think, age group for family docs. We understand people who are transitioning into adulthood so well, and we can provide really informative information, healthcare content to people. And then also family docs are just such important, players in policy and advocacy. It's something that I'm really passionate about. And being able to use as a family doc, link in, hey, MAFP, I want to at them, and then I can pull them into a conversation, and then I'm adding, a legislator, and here is my example of what I'm seeing as a family doc in this space, and here is this place where I can, create a conversation with every single person at the table. So those are just some examples.
Great. How do you balance when social media seems like a drain at times for you? Do you take breaks, and do you have any stories about that?
Yeah, it can, and it has for me. I think it probably does for everybody. And I'll say this again. Social media is designed, like these platforms are designed to make you want to use them more and more and more. And it's important to recognize that. They're great tools, but recognizing boundaries, I have had to create boundaries for myself. When I was in residency, I would give myself a small amount of time every day that I would say, this is my social media time, because I needed to be focusing on residency. And when I went home, I needed to be focusing on being home. And so I think coming up with boundaries for myself was a huge help. And again, it's totally fine to take a break. I took like a month-long break where I went on a road trip after graduating residency. That was great. So I think it's really important to take breaks and give yourself boundaries in that sense.
Have you thought about if you're going to be in a smaller area, and perhaps our patient population that you came through your training was skewed much younger than the general population. As you have an older population that may not be as active on social media, have you thought about how you're going to communicate with them. Are you going to be directing messaging to their kids and grandkids and tell them, hey, go tell Pop this, or what's your view of how you're going to handle that?
Yeah, that's a great question. I think it's just important for me to just ask where people are at. You know, if somebody brings up social media and said, hey, you know, my kid was telling me you're on social media, you know, that opens up a conversation for you to say, oh, is this something that you use? Do you look at social media? What types of social media are you using, and who, you know, you can have conversations with people. Who are what accounts are you looking at, you know? And then you can, of course, go into things like trusted sources online and that kind of thing. But I think as far as the age difference, yeah, I think there definitely will be definitely a different age group that I'll be seeing for sure. But again, a lot of adults are using social media too. Maybe I'll have to make a professional Facebook if there are people who are using Facebook who don't use TikTok or Instagram or whatever. Yeah, I'll just kind of adapt, I suppose.
All right, a two-parter here. When you're on social media, what makes you cringe? We all have cringe-worthy things. And then you said don't feed the trolls. How do you deal with that? Or how do you minimize that?
Yeah, great questions. Things that make me cringe are when people make jokes at patient expenses, like at a patient's expense. Or if somebody is posting something where I'm sitting there and saying, if I were a patient, even though they didn't say this person's name, I could totally tell that this is me. You know, I just don't like seeing it happens, unfortunately, that there will be a patient situation that ends up being, you know, the end of a joke. That's not a very nice joke. And that always makes me cringe. Yeah, makes me cringe. So anyway, but moving on, the trolls. Yeah. Oh, and I think this is a great example of where I've made mistakes. Is like, I'm going to engage with this person. I'm going to get them trusted sources. I'm going to get them to the WHO website. And there are lots of times where you just, it's not the right space to have a meaningful conversation with somebody. You can't, you know, interact with them on a personal level, and it usually goes nowhere. You usually can't convince somebody to change their mind via internet debate, from my personal experience. And so I really have now tried to, if somebody says something disrespectful, I'll delete it. I'll even have, let's say I make a post about COVID vaccines and I see there's some hot debates taken off, you know, I will put a disclaimer. I will say disrespectful posts will be deleted from my comment section. Misinformation posts will be deleted. If you have data that's contradictory to mine, please provide an adequate, valid source. Otherwise, it will be deleted. And so those are just some tools that I've used to help minimize my stress and engaging with internet, people who love internet debates.
Awesome. Well, one last question. Other than the obvious choice, which is Dr. Leslie, MD, as an influencer, who are your go-to health-related social media influencers that you think we might want to think about?
Oh, that is a great question. I absolutely love Mama Dr. Jones. She's been kind of a social media mentor for me on YouTube. She's an OBGYN. Doc JP3, he is an anesthesiologist who is just doing his fellowship. Dr. Austin Chang, he's the one you saw the video of. He's the president of AHSM, who has just so much wisdom. There's a ton of people out there who are really great, providing really, really good content. And those are just a couple. I could name like 100, but those are some great people to follow.
And so are you. Thank you so much for your time. I'm going to jump into a few more announcements, but we are so happy that you came and shared this. And there's a few other questions rolling in. I would encourage those of you who still have other questions that perhaps didn't get answered to tweet or, you know, send a message some other way to Dr. Leslie. Thank you. So please submit your evaluations for this plenary and all the sessions you attend. This is how you get CME credit. After the conference is over, provide your thoughts on the overall conference evaluation. Your daily email includes the links, and you also find those helpful links in our Family Medicine Midwest Help Desk, FMM Help Desk, in the middle tab in the conference platform. You can visit our exhibit hall at any time. Booths are not attended by a live rep, but provide a wealth of great information. Just click on the booths, learn more about these amazing organizations and companies that support family medicine. You can leave a quick note using the yes button at the bottom of each booth, or you can email the contact person for that exhibit with any questions you have. Be sure to thank them for supporting this conference during these difficult times. This exhibit hall listing will stay active until September 27th. So if you don't get to them today, go back in the coming weeks. You can also find a link to the Family Medicine Midwest Help Desk, which has a link to the live Zoom meetings where you can find a friendly Family Medicine Midwest staff person to help with any questions about the conference or the foundation. This link is valid and staffed during the conference hours. It's also the best way to get answers, as emails and phone calls will take a backseat during this busy time. For those of you who are going to our satellite CME symposium on hyperlipidemia, you can head over to that session by clicking on the session link to the right side of the education sessions. For those students and residency programs who are scheduled for the evening residency showcase, you will click the tab for residency showcase in the meeting platform. There are two options for tonight, starting at 6 p.m. Central Time, which is 1 minute ago. One for international students to meet the programs who consider and accept non-U.S. medical student graduates. The other is designed for first and second year students at U.S. medical schools who are new to this process and learning more about family medicine specialty and the variety available in family medicine residency training. You'll click the link for the showcase that fits your profile. That event opened a minute ago and will end at 8 p.m. So enjoy that time meeting with our programs, and then be sure to follow up with them in the coming days. Thanks again, Dr. Rosemary Leslie, for such a great kickoff to Family Medicine Midwest 2021, as we all emerge stronger with the power of family medicine. Enjoy your evening, and we'll see you all at those next events.